Hi, everyone. Good morning. It's good to see you all here. My name, for those of you who don't know me, is I'm Dr. Alana King, and I am the specialist in reproduction with Millbrook Equine. And today we're going to be spending the next half hour or so talking about stallions and getting ready for the breeding season. So it's January now, it's cold out. Breeding season is at least 3 weeks away for some of you, and for some of you, it's probably even longer than that. But I think it's actually the perfect time to start thinking about getting your stallion ready for the breeding season, because it gives us time to address any potential problems so that we're not discovering these things when there's a shipment due out tomorrow. And it gives us also time to change our management plan if necessary. And also there's going to be some of the things that we're going to talk about, like vaccination and things like that, that require a bit of lead time. So most of the discussion today, I'm going to spend on the breeding soundness evaluation. I think every breeding stallion should have an evaluation at the beginning of the season, so we know what we're working with going forward. And at the end, I'll talk a little bit about genetic testing that you may want to do, as well as the recommended vaccination schedule. So the breeding soundness evaluation is the examination that we do to make sure that your stallion is able to do his job. Okay, so we're looking at general health. We're looking at the health of the reproductive tract, both internally and externally. And of course, we're doing a semen evaluation. And so if everything goes well, then your stallion is ready to breed mares, but it also gives us a chance to identify problems. And as I mentioned before, you know, we may need to change our breeding plan going forward. So general examination, of course, is important for every horse, and the stallion's no exception. Reproduction is sometimes thought of as a luxury item. So if there's limited resources available to the stallion, then they're going to preferentially put those resources into survival and not into reproduction. And also, you know, general health, so debilitating conditions or poor health are associated with poor fertility and semen samples that are less than ideal. So we want to make sure that those stallions are healthy. I like for my stallions to be at a body condition score of about 5 or 6 at the beginning of the season, on the 9-point scale here. And remember that breeding mares is also very energy intensive. So stallions that are breeding every day or every other day tend to have a tendency to lose condition over the season. And so that's why we want to start at 5 or 6 and make sure that nutritional plane is maintained through the season. The hind limb soundness is also of particular importance in this exam. So getting up on a mount or on a mare's back is particularly straining on the hind end. So we want to make sure as much as possible that they have good health in their stifles and hocks and back. And then we're also looking for any hereditary conditions. Okay, so I think the most common ones that we look for in the general physical exam are malocclusions. So this would be a horse that would be excluded from a breeding program because of his severe parrot mouth. But there are also hereditary conditions that are coming to light now that we didn't used to know were hereditary. And I think, you know, they're worth thinking about in your breeding stallion, things like OCDs, kissing spine, things like that, degenerative suspensory ligament desmitis. Those are things that we're discovering now have a highly heritable component. And so we want to evaluate those things in the breeding soundness exam as well. So after we're finished with the general exam, we move on to looking at the reproductive tract. And we start by examining the penis and sheath. And we usually do that when the stallion's coming into the breeding shed and starts teasing the mare, drops his penis, and that gives us a good opportunity to take a look and look at the health of those structures. So this image here, sorry, I don't have a pointer, but the image at the top there is an example of squamous cell carcinoma, which is very common on stallion. It's common to find it on the non-pigmented skin. And also notable is that even solid colored horses can have pink spots on the penis. And so any horse that has them is very susceptible. This is a lesion that we probably would not be looking at in the breeding shed. Usually something this extensive would be found at home. The lesions that we tend to see, yes, I have an arrow. The lesions that we tend to see in the shed are more like this one here on the right. So it's very small, and usually they're not even noticed by the owner. So that's an example of coital exanthema, also called equine herpes virus 3, and it causes blisters and erosions on the penis, which are quite painful for the stallion, and it can also be transmitted to the mare. So that's something that we're looking for. The bottom picture is demonstrating a case of habronomiasis. So those of you who spend time in the South might know it as summer sores. And they're worm larvae that's transmitted by flies. And since the flies like moist areas, they tend to happen on the penis more often. And actually, this particular picture is showing, if you can appreciate, this is the urethral opening, and then this little red spot at the bottom is the summer sore. And I find those lesions in that particular location quite often, actually, probably because it's a mucocutaneous junction, it's moist, and flies like to go there. So all of these lesions can be really painful during breeding for the stallion, and they can also introduce blood into the semen, which is not ideal for fertility. So we're looking for all of those things. After we're done with the exam, the next thing we need to do is take cultures. Now, obviously, the penis is not a sterile environment, so we're expecting to find a healthy, robust population of bacteria here. But what we're looking for when we do the primary set of cultures is basically an overgrowth of a particular species of bacteria. So sometimes these stallions can get colonized with the wrong types of bacteria. Particularly what we're looking for is Klebsiella pneumonia and Pseudomonas aeruginosa. So those are two bacteria that are associated with uterine infections in mares. And so when they are overgrown on the stallion's reproductive tract, that can lead to transmission to the mares. I want to back up for a minute and just say that most uterine infections in mares are a mare problem and not caused by the stallion. So if you have a mare with a uterine infection, I wouldn't automatically jump to blaming the stallion, but certainly there can be transmission in some cases from the stallion. So that's one of the things that we're going to look for when we're taking our cultures. The other one is contagious equine metritis. So that is a true pathogen. It's not found in the environment. It's it's a venereal disease. So it's transmitted from mare to stallion, stallion to mare, and it causes severe uterine infections and abortion in mares. It's also a reportable disease. So it's fairly well controlled in this country. We don't see outbreaks very often, but in a full, complete breeding soundness evaluation, it'd be one of the things that we're looking for. And so these pictures are just showing you some of the sites that we culture. The urethral sinus, most of you probably know it as the spot where the bean grows. And it's a particularly bacteria-filled area. So that's one of the areas that we're looking at. The urethra, we look at the skin on the shaft of the penis and the sheath as well. And then so the next thing we would do is examine the testes or the scrotal contents. I've kind of put all of the external genitalia together here to talk about, but in reality, what we would do in the breeding soundness evaluation is usually a cursory evaluation of the scrotal contents before the stallion walks in the shed. So we would just make sure that there are two testes. So usually breeding cryptorchids or stallions with retained testes is frowned upon, making sure there's not a giant tumor or something that would probably end the breeding soundness evaluation at that point. And then we do the rest of the exam after collection. And that's because most stallions don't really appreciate having their scrotum handled. And so this way we can sedate them. That allows the testes to drop into the scrotum and we can get a really good exam. So the first thing that we do is palpation. This is a picture on the left here of a healthy, normal testis and epididymis. So that's what we're palpating inside of the scrotum. A normal testis should be about the size of a large egg, and it should have the consistency of a brand new tennis ball. So it's firm, but with a little bit of give. And then we're also palpating the epididymis here. This is the area where the semen is stored. It's not typically associated with major problems, but you want to make sure that it's oriented correctly. So it's towards the back of the scrotum. And occasionally we find things like calcified regions and things like that that we could palpate. This image on the right is sort of one of the major things that I'm on the lookout for when I'm palpating the testes, testicular degeneration. So this can be caused by injury to the testis, or can also be a normal age-related change. So eventually all stallions will experience testicular degeneration. The hope is that most of them won't have that problem until they reach their mid-20s, but we certainly see stallions that start to be affected in their teens, and sometimes even earlier. So the picture on the left is these are a couple of castrations that Dr. Ferraro and I did. And the testis on the left is from a healthy 3-year-old. And the one on the right there is from a 16-year-old breeding stallion that I worked on for a number of years, who was experiencing testicular degeneration, and it eventually progressed to the point that he couldn't be bred anymore. He just didn't produce enough sperm. So you can see that the tissue of the testis has atrophied. The testicle is small, and when you palpate that, it's quite soft as well. So then we want to get some cold hard data. So we want objective measurements of the testicular tissue. So we're going to look at there's 2 ways that you can measure it. There's the total scrotal width, and we get that using these calipers. So you just place them on the widest point of the scrotum, and that gives you total scrotal width. And then we can also do it by using the ultrasound at different planes across the scrotum, and we can actually measure the testis. So we can measure height, width, and length. And since they're egg-shaped, they're an ellipsoid, we can plug those numbers into a calculation for the volume of the ellipsoid, and we can get the volume of the testis. And both of those measurements are associated with normals for each different breed. And so we certainly want to compare those results with average and make sure that they fit into the normal range. And we're also going to use those numbers to determine what the daily sperm output is. So just to back up for a minute and talk about physiology for 1 second, if you'll bear with me here. This is a section of testicular tissue under the microscope, and it's demonstrating what's called the seminiferous tubule. So that's where sperm is made. This is kind of the membrane of the tubule, and then it's filled with these progenitor cells at the bottom, whose job it is to divide and mature. And as they move along the layers of this tubule, they become sperm. And I don't know if you can appreciate that, but these little structures here in the middle are sperm heads with their tail sticking out into the lumen of that tubule. And that is all there is in a testis. It's just packed with seminiferous tubules. So if you have a larger testis, you have more seminiferous tubules, and so you're making more sperm. You're just cranking out sperm all day. If you have a smaller testis, then you have less of the seminiferous tubules. And so we know that the weight of the testis is actually highly correlated with how much sperm that stallion is capable of producing. Larger testis, more sperm. And somebody's actually worked out that number. So each gram of testis will produce 18 to 20 million sperm per day. So we know that if we have measurements for the weight of a testicle on a stallion that we're evaluating, then we can determine what their total sperm would be for the day. It's kind of hard to weigh a testicle when it's attached to a stallion. So we use our measurements that we took for volume, and we use those to approximate the weight. And then this formula down here is the formula that I use in order to estimate or to convert that number of what the volume translates to in terms of daily sperm output. So then again, we have normals established for each different breed. And we also use that number to compare to the actual number of sperm that we get when we do the collection. All right, so semen collection is the next part of the evaluation. And it's not just a means to get the semen. We're actually evaluating the stallion during this part of the BSE. We're looking at libido. Okay, sometimes they can have poor libido because of temperament or because they're novices. So they're like, you know, they're not really sure what they're doing. But sometimes it can also be an indication of an endocrine problem, low testosterone, for example. The other thing that we're looking at is the ability to ejaculate. So this is Lee and I in the breeding shed with our cool little helmets on. And Lee's job is to tell me, because I'm usually under the stallion, her job is to tell me when the stallion is flagging. So she's looking at the tail, and when the stallion ejaculates, the tail pulses up and down, and that's related to the urethral pulses that occur during ejaculation. We do see a significant number of stallions that have trouble with this area. And, the most common reason that we see that they have difficulty ejaculating is pain. Okay, so a lot of times we'll see these stallions get on the phantom and they're interested and enthusiastic, and then right about the time when they need to start thrusting vigorously to achieve ejaculation, they'll kind of back right off. Some of those stallions are helped with Banamine or pain medication or attention to their back and hind end. And then in other cases, they actually have reproductive tract issues. So this is a cool case that I worked on in my residency. This was a stallion that had just a lot of difficulty ejaculating. He was a teaching stallion of ours, and sometimes we couldn't get him collected at all. And then he was later retired and euthanized for other reasons. And so we looked at his reproductive tract and we found that there was a very large cyst. So this arrow is pointing to the ejaculatory ducts. So that's the very tiny duct that the semen has to travel through in order to get to the urethra. Okay, the urethra is here. That's what we've opened here. So there's one, and there's the other duct. And you can see this white material in the middle is a very large cyst that's impinging on those ducts. And so he actually had mechanical trouble getting the semen to go through his reproductive tract.
You ultrasound that to find them?
You can. It's very difficult to see because even though that cyst is comparatively large, when you compare it to the duct, it's quite small overall. So she had actually ultrasounded him. My mentor, Dr. Poser, had ultrasounded him and was suspicious that there was a cyst there. And that's why she was looking. And she has determined that that problem is actually more common than we used to think. All right, so after we've obtained the semen, the first thing that we do is look at the color grossly. It's a very good, the sperm cells are kind of the material in the semen that makes it white. And so if we have more sperm cells, we have a wider sample. So the first thing I do is kind of get a rough idea of what the concentration is by looking at it. The sample on the left is going to be a lot more dilute than the one on the right. We can also see funky colors. So pink means there's blood in the semen. Red means there's a lot of blood in the semen. And we don't usually see this degree of blood in the semen except when there's a tear in the urethra, which is also a common affliction of stallions. Because the pressure in the urethra is so high during ejaculation, it can actually cause tears there. And then smaller amounts of blood we see with tears. We also see them with infections and some of those penile lesions that we were looking at before. Then again, we want data. So we're looking at volume. We're going to measure the volume, and then we have a machine that is going to actually give us a number for concentration. So how many sperm per milliliter are in that sample? I have a lot of clients who worry about concentration a lot, especially if it gets, too dilute. The volume and concentration are sort of inversely related. So when you have a higher volume, you'll usually have a lower concentration. And that's just because the volume is determined by the amount of fluids that are added to the sperm during ejaculation. Okay, so more fluids means more volume. It also means less concentration. And this is usually a product of how much the stallion has teased that day. So if he's been housed across the barn aisle from a bunch of mares that are in heat, you're going to get a high volume and a low concentration. Whereas if he just walks off the trailer into the shed and you get him collected on one mount, then you're usually going to see a much more concentrated sample with less volume. So I forgot to show you that one as well. That's a yellow sample, which is a stallion that had urine contamination of his semen. All right, so back to concentration and volume. So the number that's a lot more important than either of those two numbers is going to be the total amount of sperm in the ejaculate, and we can easily calculate that by multiplying concentration and volume together. All right. Then we're going to, usually in a breeding soundness evaluation, we're going to do 2 collections that are an hour apart, and that's because that epididymis that I was showing you earlier does store quite a lot of semen. And so the first ejaculate will usually have a much higher amount. And then we expect the second collection to have about half as much sperm in it as the first one. And the idea of that second collection is 2 things. One is that we're getting a little bit closer to the daily sperm output because we've gotten rid of what's stored. So that should be a more closer approximation of how much sperm that stallion is making in a day. And the other reason is that when we go to evaluate that sperm, we want to get rid of the stuff that's older and maybe not as viable as the fresher stuff. So we want a nice fresh sample to evaluate. And then once we've calculated what the second ejaculate total sperm number is, we can then compare that number to the number that we calculated earlier when we were taking measurements of the testes. And if we have major deviations from that, then we know that there's a problem. So if we calculated much higher number and then we actually get a lower number, then maybe we have a tumor or maybe we have testicular degeneration happening. But more commonly, what we see is a much higher number. And that's a problem that a lot of stallions have called accumulation. All right, so in the normal stallion, the epididymis stores semen for about 5 to 7 days, and then it has kind of a self-cleaning mechanism where it will get rid of all of those old semen and void them in the urine. But some stallions don't have a very functioning system that way, and they just keep storing and storing and storing, and that semen gets too old, it starts to die and degenerate. And so when we go to collect them, we get a huge number of sperm cells, and they're very degenerated. So in this sample, you can see most of the sperm in the sample are just heads with no tails because they're degenerating and dead sperm. And then this picture here, so sometimes they can accumulate so much that the sperm actually starts to form a concretion, like a plug, and it actually forms a physical blockage. So in those stallions, we'll collect them and we'll get no sperm at all, even though it's clear that they ejaculated. And that's because the sperm is just blocked from coming out. So this is a plug that we were treating a stallion who was plugged and did succeed in removing that plug. And then they usually require a whole bunch of collections to get rid of all that old stuff after that. So after we do that, we do the semen evaluation. Morphology, which is examining the structure of each individual sperm. We usually count about 100 of them and evaluate them to see if they're normal or if they have structural problems. That's probably the test that we do that's most closely related to fertility. And we like to see at least 60% normal cells. Round cells, I should have put a picture of a round cell, but basically it just looks like not a sperm, just a big round cell. Those can be immature cells or they can also be white blood cells. And neither of those things are things that we would want to find in our sample. Motility, of course, is also important. So we want to make sure the sperm is moving and it's moving progressively forward. And for stallions to pass their breeding soundness evaluation, we like for the progressive motility. So the sperm cells that are moving progressively forward, they're actually going somewhere and not in a circle. We like them to be at least 50%. And then in our lab now, we have the capability of using some special stains with a machine to count. So we have this stain that can only penetrate a damaged plasma membrane in the sperm cell. And so we can actually count up in the sample what percentage are viable and which ones are not viable based on the way that they stain. Those are just some of the tests that we do in the lab routinely on a BSE. There are dozens of other tests that they can do that we can ship the semen out and do special tests, but those are usually reserved for stallions who are having specific problems. So we wouldn't do them in an ordinary BSE. And then we can look at the internal reproductive tract. We can do that by both ultrasonography. So looking for things like those cysts that I was showing you, looking at the accessory sex glands, make sure that they look healthy. And then we can also do urethroskopy, where we put an endoscope into the urethra. That would be looking for things like those urethral rents. This is an image of the ejaculatory ducts. So we're looking here to make sure that there's no signs of infection. This isn't something that we would do routinely again, but if we have a stallion with a history of problems, or we've identified something on the breeding soundness evaluation that wasn't quite right, then we could do that as well. So hopefully we can use that information to maximize fertility of those stallions. Here are some changes, depending on what we found on the breeding soundness evaluation, some changes that we can make to improve fertility. Stallion housing is a big one. So stallions that are housed together, it's been shown that usually there's one dominant stallion, and the other stallions will often, who are kind of the submissive ones, will have lower levels of testosterone and changes into their endocrine profiles. So if we've identified stallions that maybe don't have good sperm output or have low libido in the shed, moving them away from other stallions can be very helpful. Supplements, there are some great supplements out there. Antioxidants, especially ones containing alpha lipoic acid. There's been a lot of studies coming out on that in recent years. It really helps to, so the sperm is basically just a packet of DNA, and it has a bunch of mitochondria at the back to power the tail. And the mitochondria are what produce a lot of free radicals. So sperm cells are very susceptible to damage by free radicals. And so anything that we can do to help minimize the free radical damage in those stallions is helpful. All right. And so alpha lipoic acid, vitamin E and C have been shown to be extremely beneficial. Omega-3 fatty acids, in my experience, they've been helpful with stallions that don't cool very well, but generally they don't help fertility for stallions that are doing live cover. And then L-carnitine is another one that you'll find in a lot of stallion supplements. Lighting programs. So we talked a little bit this morning about equilume and lighting programs for mares. Stallions are also long day breeders, just like mares are. And so we find that in the winter months, their sperm output is much lower than in the summer months. And so that's what this graph is showing you. So the summer is here in the lighter blue, and then the winter in the darker blue. And then at the bottom, you have age. Okay, so not surprisingly, as the stallion's testicle gets bigger and bigger as they get older, they start to put out more sperm. But you'll see that they are producing significantly more sperm in the summer than they are in the winter. So if you have a stallion that's breeding in February or March, it might be beneficial for that stallion to be under lights, just like your mare would, starting in December 1st or so. And then extender trials. So sometimes we can pick up the quality of semen, of sperm cells with certain additives in the extender. Pentoxyphylline is one that tends to give sperm a big boost. So when we see stallions that have motile semen, but maybe not as good as it could be, so the velocity of that semen is kind of sluggish, we can often improve that with additives like pentoxyphylline. And then and cholesterol also can help with stabilizing sperm membranes and helping with viability of that sperm. All right, so that's the bulk of things. How much time do I have left? Should I wrap things up here soon? All right, I'll just briefly go over genetic testing here. So each breed kind of has their genetic problems that are kind of controlled by a single gene, usually transmitted through dominant or recessive pathways. And we have a lot of tests available to us now to sort of screen those stallions and make sure that the genetics that they're passing on are healthy. Okay, UC Davis has over 60 tests available. I think the Animal Genetics Lab also has a bunch of them. They're usually pretty inexpensive, $40, I think, for a basic one. And that can tell you if your stallion is a carrier for a number of the diseases that you might see in your breed. They also have color coat panels. So if you're interested, you know, I have some dressage clients who only want black foals, for example. So they want to know if their stallions carry double black genes so that they can make sure that all the foals turn out black. And they use that to kind of as a bonus for advertising their stallion. To take a genetic sample, it usually requires the roots of the hair. So you can see in this picture, right? You can't just cut the hair. You have to actually pull it out so that you have these little root balls, because those balls have the cells attached to them, and that's where the DNA is going to be extracted from. And that's probably all I'll say about genetic testing. Vaccination. So core vaccines are something that we recommend for every horse. So tetanus, Eastern Western encephalitis, West Nile, and rabies. Every stallion, every horse on your property should probably be getting those. And then for the stallion, we look at some of the other things that are of particular importance. So contagious diseases, these stallions are usually coming, if you're doing live cover or pasture breeding, they're coming in contact with a lot of other outside mares. So equine herpes virus 1 and 4, particularly important when stallions are coming in contact with mares because it can cause abortion. Flu, strangles, and then also diseases that cause high fevers, which include all of the diseases that I just mentioned, as well as Potomac. So fevers are very bad for stallions. There's a reason that the testicles sit very low in the scrotum. It's because they like to be cooler than body temperature. And so when stallions get fevers, it can interfere with the processes in the testes that produce sperm. And so, and these changes can be evident for up to 70 days after a stallion has had a bad fever. So we definitely want to avoid during the breeding season their possibility of getting any prolonged or highly elevated fevers. So these are all things that you're going to want to do. I also particularly recommend strangles if you're doing a live cover situation, because strangles running through a breeding farm is not fun. And then for the stallion, particularly, we worry about EVA, equine viral arteritis. If you were here at my talk last year, we talked extensively about EVA. I'll just kind of brush on it quickly. So it causes a lot of non-specific signs, and they're usually quite mild. Depression, hind limb edema, cough, nasal discharge. In the stallion, it can also cause scrotal edema, which also, insulates the testes, so it's not good for sperm production. But the bigger problem when it comes to stallions that we're concerned about is that they have the potential to become long-term or even permanent carriers of this virus, and they shed it in the semen. So it can be shed via the respiratory route, but also in stallions through this venereal transmission. And so they can breed mares. It survives shipment, it survives freezing, so it doesn't even matter if it was live cover or not. They can breed those mares who usually live on a breeding farm, and then those mares will then shed through the respiratory route and spread it to the other horses and cause abortion. So we want to, of course, avoid that situation. And there's 2 different ways that I recommend for controlling and preventing this. One is to test, at the bare minimum, test your stallion every year for EVA to make sure that they haven't picked it up by the respiratory route somewhere at a show or anywhere else they came in contact with other horses. And then I strongly recommend vaccination. It's a very safe and effective vaccine. Some breed registries require it, but not all. But there's a few considerations that you have to take before you vaccinate. So the biggest thing is that movement of horses, this is a disease that's controlled for in imported and exported horses. And most countries control for it by doing a blood sample test of the horse. So if your horse is positive, they may be denied entry. After you vaccinate your horse for EVA, they'll always be positive. They'll always have antibodies and test positive on that blood test. And it's not able to differentiate if they became positive through vaccination or natural infection. And so the most important thing to do before you vaccinate your stallion is to draw the serum, take a blood test, prove that it was negative, and then immediately vaccinate that stallion. Okay. And then you keep that negative result forever. And you also keep records that you have kept up with the vaccine on a yearly basis forever. Because otherwise somebody might say, well, that could be a natural infection and we're not letting that stallion come here. After vaccination, the first time, it's a single injection. Even the first time, it's not required to be boosted, 3 weeks later, like most vaccines are. But what is required is a quarantine period after the first time that the stallion's been vaccinated, which is kind of a pain. But the concern is that it's a modified live vaccine. And so those stallions may shed the vaccine variant of the virus and cause another horse on the property to test positive. It's not medically a problem, but it's from a testing standpoint, it can be a problem. And so that's why we vaccinate, or why we quarantine for 3 weeks. All right, that's it. Does anyone have any questions? Oh, so the pentoxifylline was actually, it's an additive and an extender. In the extender, yeah. So there's Botu Semen Turbo. What's that? That's a good question. Someone should do a study on that. Yeah. Oh, I'm sorry. The question was, if we put the stallion on pentoxifylline systemically, will that improve our semen parameters? And the answer is, I don't think anyone knows for sure. But it would be an interesting thing to check out. But certainly if you're doing, reinforcement breeding or anything like that, it would be a good one to use. Yep. Urine in the semen. It's sometimes caused by neurologic problems. So the kind of switch over. So in order to have the ejaculate come through without urine, the sphincter to the bladder needs to be tightly closed, or else it gets urine contaminated. And so sometimes we see that in debilitated horses, neurologic horses. And sometimes it just happens for no apparent reason. And in some cases, like the case that I put up there on the slide, that stallion had never had a problem before, and he never had a problem since. For whatever reason, he just did at that time.